Okay. Well, we've got a really nice spread of people there. Some humanists, some people from different backgrounds. So it's difficult to know how to pitch a presentation when you don't know who's going to be there, but I can adapt as we go along. So please do put your questions in the chat room and then we can talk about those at the end. I think the discussion at the end is going to be the more interesting bit probably. So we'll see. So what I'm going to cover here is just exploring different ways to respond to people at times of crisis and grief. I'm going to use examples from my book and from some funeral scripts that I've done. I thought it might be useful to have a little discussion or talk about humanist with a big H or humanist with a small h and what that might mean in terms of funerals. And then, as I say, comments and questions. So a good place to start is what is humanism, because I think that's often not a very well understood term, especially in the UK. In places like Holland, it's part of the curriculum and everybody understands it. But here it's not necessarily that well understood. First and foremost, it's not a doctrine, it's not a religion, it's about an attitude to life. So I think that's the first distinctive factor. If you ask a bunch of humanists how they define their humanism, they're all going to say things that are slightly different. It's like herding cats when you come to humanists. So I've just put here a sort of summary of what my humanism means to me. So first of all, it's about personal responsibility to make a positive difference. I don't look to anyone else to do that. It is my responsibility in my life to make a positive difference. When I see things that I wonder about or I have awe about, I look for an explanation of that in the phenomena in science and in nature and in the universe. So I'm not looking for an explanation beyond that in terms of a supernatural force. I find my meaning and purpose in life through my connection with others, my connection with nature. So not me as something that doesn't exist, that exists on its own, but it's my connection with other things and other beings, which gives me purpose and meaning. And I think, especially through my pastoral work, I've come more and more to appreciate the unique value and potential of each human being. So I have a background initially in learning disability, where part of the mission was to find people's uniqueness and not put everybody under one label and their potential. So I think that's something that has carried me through life. And then the other thing that informs my life is that I only have one life, and it concentrates your mind on making that the best of that life you can. So that's a summary of what humanism means to me. I've just put on the bottom there, there's if you fancied it, you can go onto the Humanist UK website and do that little quiz. How humanist are you? I've done it. I think I was about 80% humanist. So I don't know what 100% humanist is, but it's quite a useful little thing to do. I think there's a lot of people out there who are humanists who don't realize they are, don't put a label on it. For me, I've spent my whole life being non-religious, and it was a huge relief to find the label humanist relatively recently, because it's a positive label. Being a non-believer or an atheist or a non-religious person is what you're not. A humanist is what you are. So that's a little explanation of where I'm coming from. So just to take us into pastoral care, along with most people in the country, I thought being a chaplain in a hospital or a prison was a religious job. So it wasn't something that I could do. So I was very pleased to find the Non-Religious Pastoral Support Network, which trains and accredits me to be a pastoral carer. And so I did the training, and then I went to volunteer at a hospital. And that's really when the reality kicked in as to not everyone was ready for us to be there in terms of non-religious people on chaplaincy teams. So these are some of the sort of things that were said to me or inferred to me when I started doing this. So a sort of question, you don't have scriptures and prayers. How do you know what to do or say? How do you know how to finish a conversation without a prayer to finish it off? So there was this model of what chaplaincy was, and I didn't fit into it. So as humanists, we don't have a Bible. We don't have one source of information. They're drilling next door. I hope that's not disturbing people too much. I've got builders next door. So we don't have a book that we all abide by. As I said, it's not a doctrine, it's an attitude, it's a way of life. So another reason I couldn't get a job as a chaplain was I couldn't give communion. Now, obviously, a communion is only needed by a very small number of people in hospital for specific reasons. If you say a job, that is a requirement in a job, and you're only doing it twice a week, it's excluding a lot of people. Another thing that came up was nobody ever asked for a humanist. So we don't need you on the team. Now, people are very unlikely to ask for a humanist because, first of all, they think it's a religious service, so they won't ask for someone who's not religious. But also, not everybody defines themselves as humanists. They might just be non-religious or agnostic or atheist or whatever label they put on things. So that was another reason why it wasn't felt I was needed on the team. Another requirement is you don't have a theology degree. So how can you do this job if you don't have a theology degree? Well, theology degrees are seen as a qualification for chaplaincy for Christian chaplains. My Muslim colleagues don't have theology degrees. It's not an academic route to become an imam. So you're also saying that those people are not able to be chaplains. It seems like and also a theology degree doesn't enable you to connect with people and have the sort of conversations that we have. It means you have a theoretical knowledge of religion, but that's not the same as that human connection that we're looking at. Another comment was you can't do funerals. So in hospitals, there are funerals mostly for babies, very sadly. And that was another reason why I couldn't join a chaplaincy team, because I couldn't do funerals. And then a very helpful comment, no one would like you being on the team, which is a very good way of keeping people outside. And so when I initially got into this work, I was an outsider. I had to find my way in. I'm the sort of person, if people say, no, you can't, I find a way that I can. So I went about getting qualified as a funeral celebrant, with Humanist UK. I did a philosophy course, not the same as a theology degree, but in that direction. And I got a job at another trust which was willing to employ me. And then, of course, we moved into COVID times. And in that particular trust, when we were at the height of it was a mental health trust, they decided to withdraw us from the wards. And that's when I wrote my book. So I had time. This is another one of these books that have come out of COVID. I think everybody's sort of written a book. Well, I did too. And it came out of the earlier conversations with the skeptics who say, well, what do you say? And I thought, well, how can people know what we say unless we tell people what we say? So this book is an attempt to explain to our skeptics what we might say in terms of humanist pastoral care, but also it became a real tool for reflection for me about what do I say? I mean, there are times when someone asks me something and I don't know what to say, and the conversation is difficult and challenging in some ways as a humanist, as it probably would be for a religious person too. So I went on a bit of a journey about this, and the book it's not a big book. Anyone who's seen it, it's only a little £4, bit more than a pamphlet, but it's supposed to be a book that's quite easy to read and dip into. It's not a cover to cover book. It's like a guide in a lot of ways. And the pieces that are in there, the responses that are in there are themed around these different areas, which are all common areas that you talk about when people are in hospital. People often have quite an existential question about what their life has been about, what they're going to do with the remainder of their life. They think about their relationships. They think about their mortality. They think about things that have bothered them in their past. Quite often they're rerunning those and thinking about them. And often people are dealing with a present difficulty, which might be being sectioned. It might be some terminal diagnosis or a death or something that has changes everything. So those are the sort of themes that happen within the book. And then, so this is an example of one of the, it's like a call and response almost. So there's things that people might say, I feel that I've lost my way. And then what is in the book is a sample answer that you might give in that situation. So pastoral care is about listening. It's not about broadcasting. So although I've written this as things you would say, you wouldn't say it all in one go. This is like the idea of what you might say. So if someone, I'm going to read it out. If someone says, I feel that I've lost my way, you might say, it sounds like you find yourself somewhere different from where you thought you would be. That happens sometimes when you follow a path that peters out and you're left confused about where to go next. Or perhaps something unexpected has thrown you off course you expected to be on. It can be disorientating when your signposts and direction or expectations fall away and you are, as a consequence, unsure what to do. Your way of life is often determined by your roles and connections, your beliefs and values, your relationship with others, your ambitions and circumstances. These are some of the anchors which give your life structure and purpose. However, at times your anchors temporarily fall away, leaving you at sea until you can find them again. And if you can, give yourself time to do this and to figure out the next steps. So that's an example of how we can reflect back to people what they're saying to us. You'll see there's no solution finding on our part. We're not saying, oh, it'll all be all right. We're recognizing where people are at and the difficulty they're in, and just helping maybe to frame that a little bit. So as I say, that I don't know, there's about 50, 60 of those sample issues and our responses. And then also within that, I've put some real stories in, so like some case studies to give people insight into what it's like being in pastoral care in prisons and in hospitals. So this is an example of a real story. I've often witnessed a lot of pastoral caring between patients on neurology wards where they share the difficulties of a life-limiting prognosis. On several occasions, I've found my conversations open up to include other patients who join in to reassure, concur, or reflect. Their generosity and empathy adds to the quality and depth of the conversation. I may be acting as a catalyst, but such group interactions remind me of the importance of humility in pastoral care, and the human response to care for each other is all around us. So that again is an example of our approach to pastoral care as humanists, where we are trying to enable and trying to help people feel better through their connection with others. So we have examples, we have real stories, and there's also a section on ceremonies and rituals. So in hospitals and sometimes in prisons, there will be occasions where you have ceremonies and rituals. You might help someone have a mini funeral if they haven't been able to get to a funeral, or you might be part of a ceremony or memorial for a colleague who has died. So this is an example of, we've just had something similar at Bradford, where we recently lost a much loved member of staff. So in remembering Cecilia today, you are recognizing the gap that she has left in your working lives, the vital role that she played in making things happen and in delivering a service where every member of the team plays their part. Cecilia played her part with humor and style. She was reliable, resourceful, and skillful. To feel her loss is to recognize the size of her contribution to your working lives, her influence and expertise, which is now missing. There is indeed great sadness and regret when such a vital cog is lost from the team, but let us also consider the legacy that Cecilia has left. By working alongside you, she has already shown you the way to work differently and better. One way to honor her death is to take up her good habits, adopt her skills, and celebrate her contribution. What would Cecilia do now? Might be a question you ask yourself in the months ahead. And so you may continue to tap into her wisdom, good sense, and impact on your lives. So that's another example. So these are exemplars, these are resources that people can then adapt and use in ways they might see fit. So again, we're recognizing here connection, legacy, resonance of people's lives moving forward. And then there's also a consideration in the book on religious dialogue. So there's a section talking about how we might talk with our religious colleagues, because often we'll be part of teams that are primarily religious, how we might talk across a religious divide. And I know I always sort of try and help in funerals, I always try and recognize that as well, because there will be people in the room who are religious, and we need to include them in what we're saying and value their beliefs alongside perhaps a non-religious service. So this is an example from one of my colleagues talking about requests for prayer, because this happens from time to time. When I'm asked if I would say a prayer, I have three usual responses. Having explained that I don't pray, I offer the choice of the person having a chat with one of the chaplains, or asking one of the chaplains to say a prayer for them in a chapel, or me sitting with them in silence while they say a private prayer. If they go for this last option, I usually sit and hold their hands if they would like me to. It can be quite moving for them and for me. So that section, I think, is quite important in this book, because again, there can be a misunderstanding that bringing a non-religious person or a humanist into a team or getting them to lead a funeral service means that there's a very definite antagonism or hostility towards the religious, and that is not the case. So a fundamental understanding within humanism is that we believe in equality, and we believe in uniqueness, and we believe in people following individual paths. So for some people that will be religious. It's not a problem. So this is a bit of a summary of what I think a humanist response is in pastoral care, but in other contexts as well. So I think we affirm experience and recognize realities. For me, I think that I say this all the time. So I work in an elderly psychiatric unit in Rotherham. And every time I go in, I say to someone, getting old is rubbish, isn't it? Because that is the reality. It's really rubbish. Losing your mind, losing your independence, losing control of your life. It's really rubbish. And you have to acknowledge that to people and not jolly them along and not pretend even that things are going to get better. So in listening, I'm also acknowledging their difficulties. Secondly, it's about empathy. We show commitment and connection. So actually being present with people and actually being with them on their journey is a huge part of what we are doing. And how do you do that? That's a challenge in a busy environment quite often. But I think from what I observe in any hospital situation, there's a lot of very busy people doing lots of different jobs. To actually come and be a moment of calm with people and quietness and spending time with people and connecting with them is a really important thing. And we do that. We have the job to do that in a way that a lot of people sadly don't, because they would like to do more of that, I'm sure, nurses, but we know how hard stretched they are. So thirdly, it's about respect. So we convey acceptance and non-judgment. That means putting aside all our views about whether people have done a right path or a wrong path. So if we're talking with someone who has a criminal record, or someone who's got drug and alcohol problems, or very overweight, or swears a lot, or whatever it is, it's about coming from a point of respect, human to human, and taking seeing through that to the person suffering or struggling beyond that. And that's incredibly important to convey that, because people won't trust you unless you accept them and don't judge them. That is one thing that I think we struggle with a bit in chaplaincy. because if the perception is that someone is religious and coming with a set of beliefs that judge people as being good or bad, evil or heavenly or whatever, that can be something we have to get through with people. Sometimes when I say I'm non-religious, that does release that up. Our humanist responses should always help people believe in themselves. So people lose a lot of confidence when they go into prison or hospital or taken out of their own environment and struggling with some difficult situations can often mean people lose a lot of their self-belief. So that's something we're trying to build up. Belief in yourself, not belief necessarily in something else that's going to sort it out, because the solution to problems is to be found within. So that's also part of our focus. It's not telling people how to do this. It's about how to find their way out of the difficulty, but helping them to find that way themselves. And this last one, I've been thinking about this quite a lot recently, because some of my religious colleagues who I work closely with often talk about hope, and that is part of what we're aiming for with people. And I'm not sure that's always the case. I think sometimes there isn't a great deal of hope in things getting better. I think when I talk with people, we talk quite a bit about the present moment and a sort of mindfulness idea of finding satisfaction and pleasure and it in the moment rather than thinking too far in the future. And if you pin hope on something like going to heaven or God sorting something out, that's a different way of thinking about the world from how necessarily we think about it. So that's something I'm still reflecting on at the moment, but and something we might want to talk about in afterwards. So those are what I think a humanist response is to in pastoral care. But I'm going to show you a picture now of where I work now, which is in Bradford. This is the spiritual, pastoral and religious care in Bradford, and my colleagues there. I'm within that team. And I think all those qualities of good humanist pastoral care are what all these people do. So I don't think it's exclusive to humanism. I think we're all on the same page in this team about being about the human to human contact and finding what we have in common as humans. And that whether that's the imam here talking to a Sikh lady, or whether it's me talking to a Hindu gentleman, you know, we can find our common compassion and kindness, and then if there is a religious requirement, we can then pull people in to assist with that. But there are teams around the country where we are all working in a very similar way on those principles I've just talked about. So what I'm going to move on to now is just talking about how pastoral care fits with my funeral celebrant role. Because I think there is a huge overlap. The way I do my celebrancy, there's a huge overlap. So I don't do a lot of funerals because my main role is in chaplaincy, but the funerals, so I do occasional funerals, and because of that, I have the luxury of really crafting them to an extent that you probably couldn't do if it was your main income. But I think what I bring from my pastoral care is a familiarity about being in that space of other people's trauma and crisis, and being calm and receptive to that. So in the family visit, I think my listening skills, prompting skills and reflecting skills are obviously used. I think the non-judgment is really important at that stage. I'm speaking to people who know this as well, so I'm not saying I'm an expert in this in any way, but the more you convey non-judgment, the more people will tell you, and that's non-judgment as well in your script. You know, when you're seeing off somebody who's drunk themselves to the end, you know, it's a way of conveying that without judgment. as part of their life course. And I've put here no platitudes. They do fall out my mouth from time to time, but I'm a bit allergic to them. You know, the idea, oh, it's all for a purpose, or it'll all be all right in the end. And we do these sort of a little sort of reassuring strokes on people, I think, without always thinking about them. So that's something I try and avoid when I'm with my family visits. And then the next point, focusing on uniqueness. I touched on that already. I think that's at the core of humanism, is the uniqueness of each individual and their unique story. I still find it absolutely incredible that people born in the same year in the same place can have led such completely different lives, and how much happenstance there is in that. And I mean, it's incredible. I'm endlessly curious about people's life course. So one of the things I pursue with families is what makes that person unique. And sometimes people find that quite hard to find. You know, you might, oh, well, she's just mum. That's just how she was. And to dig to find what is unique about them. In some families where people haven't necessarily talked about people's individualism, that can take quite a bit of digging to find it, but we do get there, because your funeral should be unique to you, not anything that anyone else, you know, can't be recycled or reused from anywhere else. At that moment, it should be unique. I think the other thing that I focus on is the mourner experience. So again, one of the questions that I ask when I do the family visit is, how do you want people to feel when they're there, and how do you want people to feel when they've left? And I think that gives me a steer then as to what to include in the script and the planning. And lastly, my experience fits with this idea of pre-planning, which we offer through Humanist UK, which is helping people with the prospect of their own mortality plan their funeral or their end stop, or whatever they call it, their event, in a way that settles them. So that's another service that I offer. I've only really done it twice so far, because it's not one that you can really market as such. It's through friends who've asked me to help. So yeah. So then just this question of big H or little h humanism. I think there's a lot of people out there asking for humanist funerals, and a lot of people, you know, civil and independent funeral celebrants offering humanist funerals. And I'm not precious about this, whether it's big H or little h. We are trained to do big H funerals, which means it would be for people who define themselves probably as humanist or have a humanist outlook, where some of the content would be talking about the concepts of humanism within the funeral. But I'd say probably only a small number of the funerals I do are big H funerals, where people have sought me out from the Humanist UK website because they want a humanist for the worldview part of it. A lot of funerals are humanist small h, which sort of means missing out God, and at a basic level. So that, I think that might be interesting for us to talk about at the end, where the line is between those, and does it matter? So I will have some colleagues who do big H funerals who won't have religion mentioned in it at all, and wouldn't have a Lord's Prayer, for example. Whereas others of us are more relaxed about that. We might not say the Lord's Prayer, we might get someone else to read it, but you know, the people at the funeral are going to be a mixed group of people. The person who being buried or cremated might have stipulated they want non-religious, and we've got to marry that up and make it work for everybody. So I'm just going to go through now. I've got some examples from scripts I've done of where we focus a humanist funeral. So the first area I think we focus on is on legacy, what people leave behind. And legacy can be interpreted in so many different ways. I'd love to leave a legacy of a garden like that. My garden doesn't look like that. But that could be one of the legacies that you leave. So here's an example from a committal that I did, which talks about legacy. Thank you, Frank Williams, for your many lists that drove your purpose and productivity, for your enthusiastic engagement with communities wherever you lived or worked, for your influence in the academic teaching of politics, for your belief in young people to achieve and lead good lives, whatever their starting point, for your dry and mischievous sense of humour, and for your part in securing a viable future for the Transport Museum, and for your love and passion for your family. You have left a legacy that has influenced education, safeguarded history, and improved individual lives in small and large ways. A legacy which fills your family with pride alongside the grief they feel at your loss. It is in those memories and actions of other people that people live on. And Frank, you continue to serve the world through what you have taught and given to the people you knew. So I'm just going to do these examples again. We can come back and talk about these. I don't think I'm doing anything. I'm not setting myself up as a paragon of virtue here or the only way to do this. I'm just taking you through how I think about humanist funerals. So legacy is one area I look at. Another is meaning. So that meaning can be, I tend to focus that on the meaning you have for the people who are left behind. So here's an example of the reflection in the ceremony. You are invited to consider the meaning that Sarah had in your life, for it is in your life that she lives on. In what ways did she change your thinking or outlook? How did she help you on your journey? How did her life inspire you in yours? Recognizing the meaning she had to you, emotionally, intellectually, and spiritually, honors her life. And then another area that we might focus on is purpose. So some people have a very clear idea what their purpose in life has been: service to others, saving the planet, driving political change, bringing up children. You know, these are all how some people would define their purpose. Again, it's quite a useful question to ask in a family meeting. How do you think she would have described her purpose in life? Gets at some different things. So I'll give you an example again of somebody who was a community activist. Tony Benn once said, you need two flames burning in the human heart: the flame of anger against injustice and the flame of hope you can build a better world. Bill was disturbed and distressed by suffering and injustice, but the flame that ignited his heart was his optimism in people and their potential, in which he passionately believed. His community activism drove his ambitions to make the world a better place. That was a big H funeral that I did that for. So this is a man who humanism drove his life. And lastly, I think the other thing that we might concentrate on, and this is different combination, a different emphasis for each person that you might be doing a ceremony for: connection. So some people, a picture I've got there is someone who's obviously very connected to the world and nature through physical connection, but finding out what people's connection is. So here again is another example. Julia loved the collaboration and connection that came from her music making. She said that music was her religion, whether playing on her own or amplified through playing with others. She's remembered for her generosity and support to other players, including her nephew Henry, with whom she played violin. Julia's love of klezmer music connected her back to her Jewish roots and Viennese origins, and she said that it was like a life force inside her when she played. So lastly, I said earlier on about thinking about the mourners in the room, and I tend to think of a takeaway for people. It might be a takeaway if there's children in the room. It might be, I remember one service I directed almost exclusively to an older lady's remaining sister, because all the effort had been to get the sister to this, who was very infirm, to the funeral. And it was that the family wanted me to direct the funeral at her and her needs and what she was going to take away from it. So the one I'm going to offer here is one that I'm doing actually on Tuesday coming for a family where my reading was that they need this takeaway. We've concentrated today on the joyous and highly capable first 86 years of Betty's life. Very sadly, her final 2 years were not the cosy, companionable and relaxing times that she deserved and her family wished for. Dementia not only robbed her of her memories and capabilities, it distressed and disorientated her in cruel ways. The trauma of witnessing her demise may linger yet a while, but should not define how Betty is remembered. As a lifelong carer herself, she would have understood the challenge of supporting her through this difficult last chapter of her life. Undoubtedly, ever the pragmatic, her priority would have been the well-being of her daughters and grandchildren. Dementia took Betty's mind and personality quite a while before her physical death. And today we are rolling back time to celebrate her in her prime and to appreciate that she is no longer in that difficult place. So that's really brought me to the end of what I was going to say. But as I say, I hope the discussion and questions will be, I'd rather listen to what you've got to say and to think about what we might think about some of these things together. So that gets me to the end, Sarah, if that's all right.